Have you ever looked into a mirror and wondered whether your body was trying to tell you a story long before pain, weakness, or fear ever arrived? Most people believe that serious health problems announce themselves with loud warning signs, but the human body often works in complete silence. It whispers before it screams. It sends signals before it creates suffering. Hidden beneath everyday routines and ordinary moments, the body carries messages that many people never notice. One of the most fascinating truths about human health is that your eyes may be revealing secrets that your heart has been trying to communicate all along. The eyes are often described as windows to the soul, but science and medicine have also shown that they can become windows into the health of your body. Tiny blood vessels inside your eyes form a remarkable network connected to the larger circulatory system flowing through your entire body. Those delicate pathways quietly reflect patterns of blood flow, pressure, and vascular health in ways that many people never imagine. While people spend years focusing on external appearances and searching for signs of aging on their skin, something much deeper may be taking place in the background. The body is an interconnected universe where one small change can sometimes reveal a larger picture. Your heart works tirelessly every second of your life. It beats while you sleep, while you laugh, while you worry, and while you walk through ordinary days without thinking about the incredible effort happening inside your chest. Yet despite all of its power, the heart does not always send direct warnings when stress, circulation challenges, or blood pressure changes begin to develop. Instead, subtle clues may appear elsewhere. Sometimes those clues are reflected in the eyes. Certain changes in tiny blood vessels may give healthcare professionals information that helps them understand what is happening within the body's circulatory system. This idea almost sounds unbelievable because people often expect danger to appear with dramatic symptoms, but nature rarely works that way. Nature speaks in details. Nature speaks in patterns. Nature speaks quietly before urgency arrives. Many health discussions inspired by Dr. Evan Levine often encourage people to think about the body as a complete system rather than isolated parts functioning independently. Every structure inside the body is participating in an ongoing conversation. Your heart is speaking to your blood vessels. Your blood vessels are communicating with organs. Your organs are influencing each other in ways too complex to notice during daily life. Yet all of these silent conversations may leave traces if you know where to look. Imagine carrying a message in your pocket for years without realizing it was there. Imagine walking through life with your body, attempting to guide your attention towards something important, while everyday distractions keep pulling your focus away. The truth is that health awareness is not simply about avoiding disease. It is about learning how to listen before the body is forced to raise its voice. As life moves forward, people become experts at ignoring quiet signals because the absence of pain creates the illusion of safety. Human beings naturally trust what they can immediately feel, and because the heart can continue performing its work without obvious symptoms, many individuals assume that everything must be perfectly fine. Days become months, months become years, and routines continue without interruption. Morning coffee is poured, messages are answered, responsibilities are carried, and plans are made for tomorrow. Yet beneath those ordinary moments, tiny changes can slowly develop inside the body. Blood pressure patterns may shift. Blood vessels may experience stress. Circulation can gradually change in ways that are almost impossible to detect without looking deeper. This is where the story begins to take an unexpected turn, because many people do not realize that eye examinations sometimes provide healthcare professionals with a unique opportunity to observe tiny blood vessels directly. Unlike many parts of the body hidden beneath skin and tissue, the eyes can reveal visible pathways that may provide clues about broader vascular health. Certain changes may encourage doctors to investigate blood pressure, circulation, or other aspects of cardiovascular well-being. This does not mean that every change automatically points towards serious disease, and it does not mean that looking into a mirror can become a diagnosis. The human body is more complex than simple assumptions. However, the possibility itself is remarkable because it reminds us that health often leaves footprints before major symptoms appear. Now imagine something even more surprising. Imagine waking up tomorrow feeling completely normal. Imagine having no chest pain, no dizziness, no dramatic warning signs demanding your attention. Imagine believing that your health journey is moving along quietly and predictably. Then imagine visiting a doctor for a routine eye examination without expecting anything unusual at all. Everything seems ordinary. The room is calm. The process feels simple. Minutes pass without concern. But then there is a pause. Not a dramatic pause filled with panic, but a quiet moment that feels almost invisible. The eyes are examined carefully. Small details receive attention. A pattern is noticed. Tiny vessels reveal information that was never expected. Suddenly a question appears where certainty once existed. Could the body have been speaking long before obvious symptoms arrived? Could silent messages have been present for months or even years? This is where suspense begins, because the most unsettling truths in life are not always the loudest ones. Sometimes the most powerful truths arrive softly and unexpectedly. People often fear sudden disasters because sudden moments capture attention, but gradual changes are different. Gradual changes can hide in plain sight. They move quietly through daily routines while remaining unnoticed. That reality is both mysterious and humbling, because it reminds us that health is not simply the absence of discomfort. Health is awareness. Health is observation. Health is respect for the silent intelligence of the human body and the extraordinary ways it attempts to protect us before we ever realized protection was needed. Perhaps the greatest lesson hidden inside all of this is not fear but awareness, because fear causes people to freeze while awareness encourages people to pay attention. The purpose of understanding the body's signals is not to create anxiety over every small change or every unfamiliar sensation. The purpose is to recognize that the human body possesses an extraordinary level of intelligence that most people rarely stop to appreciate. For every heartbeat that occurs without conscious effort and every breath taken without deliberate instruction, countless processes are working together with astonishing precision. Blood travels through an endless network of vessels carrying oxygen, nutrients, and life itself into every corner of the body. The heart performs its responsibility continuously and faithfully, asking for very little attention, while giving everything it has. Yet even the strongest systems occasionally reveal subtle signs that deserve respect. This is why regular health evaluations and professional examinations matter. Sometimes people wait for dramatic symptoms before they decide to value their health. But waiting for a crisis often means waiting for the body to move from whispering into shouting. A wiser approach is learning to appreciate the whispers while they are still quiet. Eye examinations, blood pressure evaluations, and routine health awareness can become powerful tools because they may reveal patterns before larger concerns appear. They do not predict destiny and they do not guarantee outcomes, but they create opportunities for understanding. Opportunities matter because every positive change begins with awareness. A healthier meal begins with awareness. Better sleep begins with awareness. Movement begins with awareness. Choosing to protect the heart begins with awareness. Looking at health through this perspective transforms the conversation completely, because health stops becoming a punishment and begins becoming an act of respect toward yourself. It becomes a way of honoring the incredible system that has carried you through every moment of your life. Dr. Evan Levine often inspires discussions that encourage people to see the body not as separate pieces struggling independently, but as an interconnected system working together with extraordinary purpose. That perspective reminds us that every organ, every vessel, and every heartbeat participates in a larger story. Your eyes are not isolated from your heart. Your heart is not isolated from the rest of your body. Everything is connected in ways that are both scientific and deeply meaningful. Perhaps that is why the idea feels almost philosophical. The same eyes that allow you to see the world around you may also reveal small reflections of the world inside you. The same body that silently supports your dreams, your memories, your struggles, and your future may also be leaving clues along the path. The question is not whether the body speaks, because it always does. The real question is whether we are willing to listen before urgency forces us to hear. Life moves quickly and distractions never disappear. But health awareness creates a moment of stillness where attention returns to what truly matters. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.